Good afternoon, everyone. This is Dr. Jeff Gelblum, your friendly neurologist who you're used to seeing here on Facebook Live, presenting to you some new information about the sequence or the order of vaccines or vaccination processes that should be provided. So for purposes of today's discussion, obviously the big elephant in the room is the coronavirus vaccine. As it stands now here in the U.S., we've got two FDA-approved products. We've got the Moderna product, we've got the Pfizer product. Both of those vaccines are similar in their mechanism of action. And they're basically very simple constructs. Each vaccine has about 10 components to it. The Pfizer product has about 10 components. The Moderna product has about 10 components. So it's a very simple chemical. And what happens is they rely upon the insertion of ribonucleic acid, RNA, of the coronavirus spike protein, the little spikes that come out of the sphere of the coronavirus. And those vaccine RNA components, that's the RNA that codes for the spike protein. So what happens is when you get your vaccination, either the Pfizer or the Moderna, basically what you're getting is a little teeny tiny dose, a nanoscopic dose of messenger RNA, mRNA, which gets injected into the muscle here. That RNA then goes into some of the muscle cells here, and those muscle cells then manufacture the coronavirus spike protein. They're not manufacturing the virus, they're just manufacturing a part of the virus. So it's kind of like, rather than manufacture the whole car, I'm just going to manufacture the tires on the car. But because I've identified the tires and because I've got the tires out there, my body thinks that it's actually a coronavirus infection, and my body is going to make antibodies and direct T cells, T lymphocytes, against that viral component. So that's the mechanism of action. That's the rationale behind both the Pfizer vaccine and the coronavirus vaccine. So it's a very simple product. It's a little strand of messenger RNA locked into a little lipid, a little fat particle, and that's what gets injected. A lot of folks have said, oh, I heard about an allergic reaction here, or this guy died there, or somebody developed a Bell's palsy up here. All of this is, the Bell's palsy aspect is completely nonsense because the incidence of Bell's palsy in folks who've been vaccinated is actually less than in the general population. And yes, there can be some very idiosyncratic, rare reactions. In fact, many of you may have heard about a colleague of ours, an obstetrician down here in Miami, who got a vaccination, and he developed something called ITP, Idiopathic thrombocytic purpura, which is basically where your platelets just get chewed up and you bleed. And that's how he died. He developed a brain hemorrhage, and that was the cause of death. It remains uncertain as to whether that single event was related to the vaccination, but I can tell you right now as it stands, 20 million of these shots have been given out, and that's the only incidence which occurred. Unfortunately, I knew the doctor who passed away, but 1 out of 20 million, you have a greater chance of getting hit by a meteor walking outside right now after this Facebook Live. So as we stand here today, the vaccines that are available in the U.S., the Pfizer product, the Moderna product, extremely safe. They are recommended for everyone over age 18. The only component in it that you could possibly develop an allergic reaction to is propylene glycol, because that's what keeps the little molecule together. But propylene glycol is in everything. It's in soap, it's in food products, it's in cosmetics. So if you took a bath today, which I hope you did, because I only like to talk to a clean audience, but if you put on any type of perfume or any type of makeup, you're using propylene glycol. So that's really the only component of the 10-component recipe that could possibly cause any problems. So I've been getting a lot of questions about this one doctor who died in Miami from idiopathic thrombocytopenia thrombocytopenic purpura, and they're saying, oh, this means we have to spend more time and stand back, and some vaccines are better than other. This is all nonsense. One incidence out of 20 million is considered to be idiopathic, and certainly the FDA is investigating very carefully, as is the CDC, but there hasn't been another case of it. So at this point in time, no one can say whether this poor doctor died from his vaccination or from something else. We just don't know. But you know what? I'll take 1 out of 20 million odds any day of the week. So I can tell you that I have received my vaccination. I received the Pfizer shot, but other doctors have received the Moderna shot. Essentially, they're very similar compositions, very exact same mechanism of action, messenger RNA injected into the muscle cells, which then makes some spike proteins, and then your body thinks that's a coronavirus, so then your body makes antibodies and immune lymphocytes against that, and that's what confers your immunity against getting sick. So listen to what I just said. Your immunity against getting sick. It doesn't mean that you can't transmit the virus, because that data is not yet there. All we know from these 2 vaccines is that you've got a 95% chance of not getting sick after you've received your second dose and waited a few weeks, about 3 to 4 weeks. So that's the timeline of vaccination. So topic of today is, well, what about the other vaccines that are out there? How does that all interplay with the COVID vaccine? Well, here's my thoughts. As you all know, the rollout of the vaccine in the United States has been atrocious. Probably the only worst place is France. But I can tell you that right now, 20 million doses have been given out. But we know that there's 350 million Americans. So, and in fact, if you were watching the news yesterday, you know that President Biden just announced an up-ramp, and Pfizer and Moderna have just said they're going to be able to pump out more vaccine, and that's great. But the issue is that there's just a problem with the delivery, with the logistics of the vaccine. In fact, I can tell you, my staff here in my office in Aventura, they got their first shot 4 weeks ago. Now, they are supposed to get their second shot, this is the Moderna product, their second shot tomorrow. But today we got a phone call from the hospital saying they don't have enough to go around for the second shot. So what do you do in that case? Well, the good news is the CDC has adjusted their recommendation for the time sequence of the vaccines. So if you get your first vaccine today, you can wait up to 6 weeks to get your second vaccine. Now, I know the package insert on the Moderna product says 4 weeks, and the package insert on the Pfizer product says 3 weeks, but truly you can go as long out as 6 weeks. And we spoke to the hospital staff today, and they assured us that there will be adequate supply to do that second dose within the CDC recommendation, which is total 6 weeks. So as long as you get your 2 shots in within about 6 weeks, you'll be okay. A lot of people have said, well, what about just 1 shot? I have fear of needles, and maybe I had a little bit of queasiness or some GI irritability as a result of the first shot. Do I really have to get the second shot? So here's the data. The first shot gives you about 54% immunity against illness from coronavirus. The second shot brings you up to 95%. So clearly, my advice is get the 2 shots. 54% is good, but 95% is great. So take the 2 shots. Now, here's the issue that I want to remind you all. We're talking about many other vaccines. Remember, the people who really get sick from coronavirus tend to be older folks. So here's the recommendation for vaccination. Obviously, everyone should get the COVID vaccine who can get that COVID vaccine. Are there any specific contraindications? Right now, the only contraindication that I could think of is if you have a documented history of hypersensitivity to vaccination. But if you've had a tetanus shot in the past, if you've had any type of vaccination in the past, a pneumococcal vaccine, and you haven't had a problem, chances are you're not going to have, and when I say chances are, it's like 1 out of 20 million, chances are you're not going to have a problem with the COVID vaccine. And I can tell you, all of us who've had it, everyone that I know who's had it, all of my medical colleagues, medical staff, medical assistants, we've all gotten our shots, and I can tell you I'm not aware of any significant adverse events. So whatever you're seeing on social media about this one guy that developed a Bell's palsy, that's where the face gets weak, or this poor doctor at Mount Sinai who happened to pass away, we're not quite sure what the correlation is, but I can tell you it is clearly not established as part of the vaccine risk profile. So at this point in time, the COVID vaccine is recommended for everyone over age 18. Hopefully, that age group will get younger as more research, as more data comes forward. One of the issues in terms of getting your vaccine, question I always have is, well, what about my other shots? I'm due for a flu shot. I'd like to get a shingles vaccine. And what about my pneumococcal vaccine? So what's the sequence that should be? Well, obviously, if you can get your vaccine today, get your vaccine today. If you have an appointment to get vaccinated somewhere, keep that appointment and stick to it. The recommendation at this point for COVID vaccine is that you probably shouldn't have had any other vaccine within the preceding 2 weeks. So if you've got an appointment for next week to get your COVID vaccine, then obviously today's not the day that you're going to get smart and say, oh, I forgot to get my shingles shot. So if you don't think that you're going to be able to get your COVID vaccine within the next 2 weeks, then today would be a great day to go and get your COVID shot, your shingles shot. Today would be a great day to go and get your pneumococcal vaccine shot. And of course, if you haven't had a tetanus shot in the past few years, you should get that, because everybody's walking outside on the beach now because they don't want to go to a gym, which I fully understand. So God forbid you step on a nail, you want to make sure you've got an up-to-date tetanus vaccination. That's all good advice. The reason why I bring up the idea of these other vaccines, these other diseases like shingles and pneumonia, is because in my practice, where we see a lot of COVID-related neurological long-haul sequelae, we see a lot of stuff where patients come in, they've had COVID a couple of months ago, and they're still having problems with memory, attention, focus, nerve pain in the limbs, vertigo, even a Bell's palsy I've seen, some stroke-like symptoms, even a seizure. Even Parkinsonian features have been reported in the literature, although I haven't seen that. I can tell you that shingles I have seen along with COVID. And you say, well, what's happening there? Well, what happens is the COVID can be so taxing to the immune system that those individuals who are at risk for the opportunistic disorder of shingles, what happens is that chickenpox virus is then let loose because the rest of your immune system is overwhelmed fighting the COVID. And as a result, I've seen shingles travel at the same time, coincidentally, in those patients who've had COVID. And that's a catastrophe, because not only are you sick from the COVID, but now you have to deal with a shingles attack. So what is shingles? As the French would say, that's la zona. And what is that? That is pain along an area of the body, typically along the chest, but sometimes it can be along the side of a face. Sometimes it can be in the buttock, going into the leg. So my thoughts are this. If you think you're going to get the COVID vaccine within the next 2 weeks, then wait for that COVID vaccine. But if you're in a younger demographic, let's say you're age 50, and you're not anywhere near that triage point of having access to a COVID vaccine, because right now it's reserved for folks over age 65. So if you think that in your community, you're not going to be looking at a COVID vaccine for several weeks, then my advice is today, stop what you're doing over age 50, hang up from Facebook, don't stay on and look at any other silly posts, because you don't need to look at anything on there again today after you hang up from this, and then go and get a shingles shot. Because there is a significant incidence of shingles that's traveling along with COVID, because again, the COVID is so taxing to your immune system that at that point, it's easier for you to acquire shingles. So the Shingrix vaccine, which is what I'm referring to now, is FDA approved for folks over age 50. So right now the cutoff is 65 and up for the COVID vaccine. So if you're 65 and under and you don't think you're going to be getting a COVID vaccine anytime within the next few weeks, then I would immediately get a shingle shot, because that is one less problem that you're going to want to deal with, God forbid, if you get COVID and haven't yet been vaccinated. Okay, so let's put COVID on the back burner. Let's put shingles on the back burner. Let's get a shingle shot over age 50, because as a neurologist, I can tell you that shingles is a very nasty disorder. It's extremely painful. Sometimes it can even cause scarring on the cornea if it hits this area of the face, and that can lead to blindness and permanent visual difficulty. So I do highly recommend, in accordance with CDC guidelines, and again, everything I'm telling you today is in accordance with CDC guidelines. So I'm not coming up with any protocol on my own. If you haven't had the shingles vaccine and you're over age 50 and you're not looking at getting a COVID vaccination for the next 3 to 4 weeks, get your shingle shot today. The shingle shot, as you may know, is a 2-part shot. You need the first shot and the booster, and the second booster can come anywhere between 2 to 6 months after your first shingles vaccination. So if you're looking at getting a shingles vaccination today, which I hope you are, if you're over age 50 and you have not gotten and you don't look at a COVID appointment in the next couple of weeks, get your shingles vaccination today, and then you'll get your second shingles vaccine booster within 2 to 6 months. During that time frame, you'll still be able to get your COVID vaccine. So the whole idea is to minimize your pain and suffering. So obviously, COVID, that's the big elephant in the room. Get your hands or your arm on that vaccine as soon as you possibly can. But in the meantime, let's do some other things to make sure that, God forbid, if we do get a COVID attack, we're not going to be worried about a co-infection with shingles, which is very common. And then the next item that I want to bring up is pneumococcal pneumonia. So for those of you over age 65 who have not yet had your COVID vaccine, remember, there's got to be a 2-week wait before you get your COVID from a prior vaccination. So again, over age 65, you are at risk for pneumococcal pneumonia as a comorbidity of COVID. Why? Because again, the COVID attack is so severe on your immune system. It really does tax the immune system. That again, God forbid, if you end up in the hospital and have to be treated for COVID there, we know that pneumonia is easily acquired in the hospital. It's what we call a nosocomial infection. It has a higher tendency to occur in the hospital by virtue of all the sick patients that are around and all the use of antibiotics. So I can tell you that anything that you can do to protect yourself from getting pneumococcal pneumonia, bacterial pneumonia, you should do. So if you're over age 65 and you have not had your pneumococcal vaccine, you can get your high potency pneumococcal vaccine. If you're under age 65, you can get the lower potency pneumococcal vaccine. And all of these things are basically paid for by your health insurance. So your health insurance really wants you to get vaccinated because they know that your risk of serious illness and hospitalization is far less if you're vaccinated. So it saves them a ton of money not having to pay for a hospital bill. So you walk into any CVS or Walgreens or independent pharmacy and say, hey, I need to get my pneumococcal vaccine. The pharmacist will be happier than anyone to give you that vaccine because he knows or she knows that that's going to be in your best interest to prevent pneumonia as an awful consequence of COVID. But remember, the two conditions travel hand in hand because once you end up in the hospital from COVID, and again, not everybody ends up there, but if you do end up in the hospital on account of COVID, and I'm sure everyone who's watching today knows someone who's gotten really sick from COVID, so that individual went to the hospital. The last thing you need during your hospital stay is pneumococcal pneumonia on top of your COVID illness. So that's why the key is to get yourself vaccinated with a pneumococcal vaccine. You get the high potency 23 valent product if you're over age 65, and you get the 13 valent product if you're under age 65. And all of this is FDA approved, and it's all CDC recommended. So I'm just giving you what is considered to be good standard of care public health policy to help keep you as intact as we possibly can during this pandemic. Next question, what about the flu shot? Well, again, if you have the initial signs of COVID, cough, sore throat, nasal congestion, fever, that could be the flu. So it's my recommendation, as well as the recommendation of the CDC, that everyone get a flu shot. Everyone over the age of 18. Why? Because if you get sick and you've had the flu shot, chances are your symptoms may be related to COVID and not to the flu. So here we are, end of January 2021. You should have gotten your flu shot in October when it first came out. But for those of you who have not, I would say this afternoon, go get your flu shot, talk to your druggist and say, listen, I'm not looking at a COVID vaccine for the next couple of months maybe. So please tell me, after I get my flu shot, when you want to see me back for my shingles shot, and then when you want to see me back for my pneumococcal vaccine shot. And the reason why I'm bringing all of these up is because in my experience, seeing lots and lots of COVID-related illness as affects the nervous system, I'm seeing the coincidental occurrence of pneumonia and shingles traveling along with the COVID. So I'm seeing three of these things simultaneously. And that is why whatever you can block out in terms of illness is going to improve your ability to deal with COVID until you get vaccinated. So today is really about defensive medicine. Make sure that you've got your shingles vaccine over age 50. That's where it's approved. Make sure that you get your pneumonia vaccine approved for everyone. There's two different formulations, under age 65, over age 65. So ask your pharmacist. Every pharmacist is eager to share this information with you. And then make sure if you're doing a lot of outdoor exercising, which many of us are right now because we're not going into the gym, and if you're walking barefoot, you want to make sure that your tetanus vaccination is up to date. Last thing you need to do is go into an emergency room right now having stepped on a nail, and you have to sit in an ER for 4 hours and get a $4,000 bill to get a tetanus shot. So that's why get your tetanus vaccination now. You can get it at the pharmacy. Very easy. And again, no one does this better than your neighborhood pharmacist. So I'm a big proponent of getting that type of care at your neighborhood pharmacy. So we've shared a lot of information today. Again, it's all about defensive medicine. I know many of you who are watching now are under age 65 and don't know when you're going to get the COVID vaccine. And to me, that's a travesty, but it just is what it is. So let's deal with what we've got to deal with. What we've got is, on our hands now is a situation where folks under age 65 really aren't able to get the vaccine unless they're doctors or ancillary health providers or bizarrely inmates in a prison. And I don't want to get too political here, but most inmates tend to be young. So that's really not a high risk group. So why those resources are going to the prisons, I fully agree for the prison workers. But for inmates, if you look at the bulk of people who are in a prison, they're young. So, that tends to be a healthier demographic. But it is what it is. That's the politics of the situation. I'm not going to get into that discussion right now. But it's my belief that every person with an arm should be vaccinated. And if you don't have an arm, then it goes in your butt or your thigh. There's nothing magical about the arm. But I can tell you that I do believe that it's imperative that you keep your other vaccines up to date. And I will tell you, I also think that as a matter of travel, you should keep that information on your phone so that if you are traveling, you can show it to a passport control officer. I think we're going to have to end up doing that as well with our COVID vaccine. And I can tell you, when you do get vaccinated, you get this nice little card from the CDC. I recommend that you laminate it and you just keep it in your passport and make sure you take a photo of that and keep it on your phone. You never know when you're going to need that. But it is really critical that you keep all of your vaccines up to date because of what we're seeing in the day in, day out healthcare arena, where folks who are coming in with COVID do have the greater susceptibility to shingles, which is extremely painful and disabling, and pneumococcal pneumonia. And again, last thing you want to do is step on a nail and have to sit in an ER with lots of sick people where the ER may be overwhelmed. They're only for a tetanus shot. So sum total of what I've discussed today is, as we wait for our COVID vaccine, and I am hopeful that each and every one of these of our viewers today are going to get that COVID vaccine, that you also make yourself availed of the tetanus shot, of the pneumococcal vaccine, and of the shingles vaccine. And on that note, I look forward to taking any of your questions via email, jgelblum@fcneurology.net, like firstchoiceneurology.net. And if any of you are having any symptoms that are neurologic associated from COVID or any other condition for that matter, I look forward to meeting with you personally in a telehealth encounter because we've been rather successful in treating these long-haul symptoms associated with COVID and getting patients back to a good state of functionality, back to work, back to homemaking, back to exercising, and all of that. So I appreciate your time today. I'm available for you. I'm sure we'll be meeting back very shortly because we've got 2 vaccines out there. Hopefully we'll get another in the not too distant future. And our technology for treating patients who are sick is getting better and better and better every week. So I look forward to sharing more information with you as this whole field of COVID science unfurls each and every day before us. So I thank you for your time today, and I look forward to seeing you all again real soon. Have a great afternoon, everyone. Bye-bye.